Question number 8. A 28-year-old G1P0 woman at 12 weeks estimated gestational age presents with malaise, joint pains, fevers, and chills for the past 3 days. Physical exam reveals a mild lace-like rash and arthritis. The patient mentions her friend, who is a medical student, told her that her symptoms are suggestive of parvovirus B19 infection, which may adversely affect her baby. Which of the following statements regarding the effect of parvovirus B infection in this pregnant woman is correct? So it can lead to hydrops secondary to fetal anemia. It can cause aplastic crisis in the neonate. Physical malformations are frequently associated with congenital infections. Fetal loss occurs in 40% of the primary infections, or the neonate may be born with a typical slapped cheek rash. Okay, so this was a question on the parvovirus B19 infection. Okay, so let's see what's happening here. Parvovirus B19 is an infrequent cause of infection during pregnancy. The risk to the fetus is the development of severe anemia and hydrops. So severe anemia will lead to CHF, and that would consequently lead to subsequently lead to edema, which causes hydrops. Aplastic crisis, yes, it is a complication of parvovirus infection, but only in those with chronic hemolytic anemia. It causes a cessation of the synthesis of RBCs from the bone marrow, causing a reduction in the hemoglobin levels, and that is about it. Congenital anomalies or malformations are not associated with parvovirus infection in pregnancy. The rate of vertical transmission may be 30%, but it does not cause any congenital anomalies. Fetal loss is also not very common. Fetal loss occurs before the 20th week of pregnancy in almost all cases, if at all it does. Erythema infectiosum or fifth disease, this is the most common manifestation of parvovirus B19, but in children. In adults, you will not see that slapped cheek rash, but in children you will. So initial symptoms are flu-like, include fever, myalgia, chills, itching, and then the typical facial rash, which has a characteristic slapped cheek appearance, which fades after 2 to 4 days. Joint symptoms are more prominent in adults. So this is something you need to remember. Adults will present with this reticular lace-like rash, and they present with arthritis, which is typically described as a rheumatoid arthritis like joint pain. So very similar in character, but children will present with a typical slap cheek rash. Okay, so let's quickly go over this one table here for parvovirus B19. This should clarify everything. So signs and symptoms, up to 75% of patients are asymptomatic or just have flu-like symptoms. Erythema infectiosum or fifth disease is more common in children with fever, non-specific fever, nausea, and a malar rash on the cheek. Acute symmetric arthralgias, arthritis, usually in the hands, wrists, knees, and feet, resembling rheumatoid arthritis. This is what is seen in adults. So this is what I was trying to tell you. Even the character of the joint pain, the fact that it is acute, it is symmetrical arthralgias limited to the hands, wrists, knees, and feet. Very typical of RA. So this is something you really need to be able to pick up on. And transient aplastic anemia, but only in patients with a history of hematologic disease like sickle cell disease. Diagnosis, either you pick up on the IgM antibodies in immunocompetent patients or NAT in immunocompromised. Previous infection with parvovirus B19 antibodies, and reactivation of previous infection by NAT to detect the DNA. Okay, so that is about parvovirus B19. Very highly, you need to be able to differentiate between the infection which is occurring in children and in adults. So the adults will be joint pain, children will be the slap cheek rash. Adults will have a rash, but it will be the lace-like reticular rash over the body.
Thanks for watching. Please give a thumbs up and subscribe for more.